Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. I'm here with Dr. Josh Reimer, our Medical Officer of Health and Medical Lead for Manitoba's COVID-19 Vaccine Implementation Task Force. Today we're announcing 5 additional deaths due to COVID-19. There were 3 from Prairie Mountain Health Region and 2 from the Winnipeg Health Region. I'd like to extend my condolences to their families, their friends, their loved ones, their caregivers. Our current 5-day COVID-19 test positivity rate is 10.8% provincially, 6.8% in Winnipeg. 113 new cases of the virus have been identified as of 9:30 a.m. This morning, taking our total number of cases to 28,810. Public health is aware that many businesses and sectors are frustrated that they're still not able to open at this point. And, it comes down to the nature of this virus. We know this virus spreads with close contact, prolonged indoor contact, especially in crowded places. The Public Health Agency of Canada, as well as, the literature in other areas, provides characterization of many sectors as low, medium, and high risk, and it's all really based on being in that enclosed location for prolonged periods of time. And so we know that these are higher risk settings in, say, restaurants, in gyms, and it's not a reflection on the efforts of that sector. It's a reflection on the virus. So you have to recall that we were here before. We were here in October and early November, where we had things that were open, and I think a lot of businesses were still frustrated that things weren't open enough. However, we saw our numbers climb. We were in that exponential climb in November that was going to overrun our healthcare system as early as the second week of December if we stayed on that trajectory. And if we go back to that level of opening, we'll be right back on that trajectory. There's no reason to think things would work out differently this time. So that's why we're doing it very cautiously, and because the more things that are open, the more interactions that occur, the more spread of this virus we're going to see, and that's despite the great efforts that we know all these sectors have done. And so we've, of course, with these loosenings, and understandably so, we receive a lot of correspondence from a lot of individuals and sectors about wanting to open. And if we allowed opening to that degree from all of the requests we received, we'd be wide open. We'd be more open than we were in October and November, and so we can only expect our numbers to be even higher than the trajectory we were getting back then. And I think we all just have to accept that we just can't do that. We can't be back in that spot. We cannot overrun our healthcare system. Our healthcare system is just right now at a spot that they can get back to some of the elective procedures, not all of it. So the healthcare system isn't there right now for everyone because of the number of COVID cases in hospital. And so we can't do things right now that are going to escalate the cases further. So I understand the frustration, but what is our alternative? We cannot overrun our healthcare system. The fundamentals are going to remain important for many, many months to come. We want people to stay home when you're sick. We want people who are symptomatic to get tested as soon as possible, even if it's very, very mild symptoms. We continually hear from our public health nurses who do the contact tracing that they're finding cases that have been out and about for lengthy periods of time because they had only mild symptoms. But what we're saying is, even with mild symptoms, stay home, get tested, even if you're not sure it's an important symptom. We have testing capacity. We don't want to miss cases, but we continue to hear in all settings of people going to work, going to school, going to daycare while symptomatic. And we just have to avoid that if we want to continue our progress and open things up. A reminder that text messages are being used to support case and contact monitoring on a daily basis, in addition to phone calls from contact tracers, and as well as automated phone messages. Text messages for monitoring is being used in combination with support from members of the Manitoba government's contact tracing team throughout the isolation period. Responding to these text messages is needed. If you receive a text message but prefer a phone call, instead you must first respond to that text message and then request further follow-up. These are being provided in addition to augment the contact tracing's overall capacity, because again, as we start to try to open things, we need to be identifying cases as soon as possible. We need people to be staying home when they're ill, and we need to reach those contacts. And so we've heard a lot of frustration as well of people who have been identified as a contact, quite frustrated that they're required to self-isolate now. And it can be understandable. This might be staying home from work and causing all sorts of issues at home. But if we want to be able to open things up, we have to be able to stick with those fundamentals. We have to have those contacts isolating. If a contact to a case is isolating, and they happen to be that proportion of people who do become a case, if they have 0 contacts, then we've just ended that transmission chain. And if we do that for the vast majority of cases, you can see that we can make a huge difference in our numbers, which will allow us to continue to open things up. Before I turn it over to Dr. Reimer, the province has been experiencing several days of cold weather, which we expect to linger for many more days. This is obviously can be a significant health concern to many. So we just want to ensure people to check the forecast, dress appropriately, consider checking on vulnerable neighbors and family and friends. And you can visit our cold weather and your health page at manitoba.ca for some more information. So I'm going to pass that over to Dr. Reimer now.
Thank you, Dr. Roussin. Good afternoon. I'm Dr. Joss Reimer, the medical lead for the COVID-19 Vaccination Implementation Task Force. As of today, we have visited approximately half of Manitoba's personal care homes with our focused immunization teams, protecting some of our most vulnerable people from COVID-19. This week, the teams will visit the remaining locations. This means that we will have immunized every eligible and consenting PCH resident in 3 weeks, which is fully a week ahead of the schedule that we had initially set. Cette semaine, les équipes se rendront dans les derniers établissements qui attendent encore leur visite. Ainsi, dans 3 semaines, soit une semaine plus tôt que nous l'avons initialement prévu, nous aurons vacciné tous les résidents admissibles de nos foyers de soins personnels. When we reach the right time frame set by the manufacturer, our focused immunization teams will go back and provide the most complete protection against COVID-19 by providing a second dose to all of our PCH residents. The teams are also going to be doing regular sweeps of our PCHs and other sites where people may be paneled and waiting for admission to a PCH to ensure that immunizations are done in those settings as well. This has been a critical part of our plan to protect some of Manitoba's most vulnerable citizens. A second update that I wanted to highlight today is that on Friday we announced that we're making a change to some of the guidance around people who have specific health conditions. We released additional guidance on immunizing special populations such as those who have suppressed immune systems, autoimmune conditions, or are pregnant or breastfeeding. Up until this point, someone who was pregnant or had one of those conditions would have been screened out in the process of booking an appointment and would not have been able to be immunized, even if they met other eligibility criteria. So this is important information both for healthcare providers, but also for Manitobans who may have these conditions to make an informed choice, weighing out the benefits of the vaccine against the risks and the unknowns that we have around the vaccine and these conditions. I sit at a number of tables with medical leads from across Canada, and we are one of the first jurisdictions to have this process in place. And we have offered to share what we've developed with other provinces and territories to support the work that they are doing on this topic as well. Finally, as you already know, last week we were informed about a third reduction in our Pfizer vaccine shipments. Manitoba has been responsible in managing our vaccine supply, but we continue to see the effects of these supply disruptions. We had to stop making appointments at our super sites, both in Winnipeg and in Brandon. So far, we've been able to weather these supply disruptions better than most other jurisdictions, based on the strategic approach that Manitoba has taken. However, we're now in a position where we're still concerned about ongoing supply and may have to postpone some of our appointments if those supplies don't resume. L'approche stratégique que nous avons adoptée nous a permis, mieux que beaucoup d'autres provinces, de surmonter les problèmes causés par le retard de livraison annoncé. Toutefois, nous sommes maintenant à un point où il devient plus probable que nous devions retarder les rendez-vous pour la deuxième dose à Winnipeg et à Brandon en raison de ces ruptures d'approvisionnement. So whether or not the postponement in appointments happens depends on what we receive from the federal government on February 8th. Right now, we have enough in our freezer to provide either the appointments that are booked for next week and the week after, or to provide the second dose to our personal care home residents. As we have been mentioning throughout, we are not holding back doses for a second dose. That's why we're in the situation now where we have to make a choice between whether we continue with the second dose at our super sites or provide a second dose for our personal care home residents. If we receive enough supply on February the 8th, we'll be able to proceed with both of those factors. We will not know until the end of this week whether or not we'll be receiving a shipment on the 8th, nor how much to be expecting on the 8th. So we will update Manitobans as soon as possible, most likely on Friday, to let them know if we are expecting that shipment to come in and what the implications are for people who have appointments coming up beginning next week. We are going to be contacting everybody who has an appointment coming up to let them know about this unknown as well. So for now, we're asking people to plan to keep their appointments for next week and the week after, but to keep your eye on the bulletins and on the website because we will be updating people as soon as we know whether or not we may have to postpone these appointments. Even with these supply disruptions, we knew we had to ensure that vaccine made it to the north. So the phone line opened this morning to book appointments at a super site in Thompson, and those appointments will be starting on February the 1st. This is a slight adjustment from our original plan because instead of using Pfizer, we're using Moderna temporarily in Thompson. Also, building on feedback from the Northern Health Region, we will be scheduling appointments for eligible workers in the PAW and Flin Flon for the week of February the 8th. So finally, to give Manitobans an update on vaccine delivered so far, a total of 29,751 doses of vaccine have been administered in Manitoba, including 26,349 first doses and 3,402 second doses. We will now take your questions.
Thank you, doctors. A reminder to the reporters on the line, we have one question and two follow-up questions today. We will start with the Winnipeg Free Press. Danielle.
Hi, good afternoon. Dr. Reimer, why did the disruption of the Pfizer vaccine deliveries delay the province in releasing its priority population schedule? Has the sequencing changed, and in what way?
The delay was just so that we had time to review and make sure that nothing in our plan would be disrupted by the changes in supply. So we needed time to ask our numbers folks, our planning and logistics people, to first off focus all of their attention on adjustments for the supply. Because first and foremost, we needed to make sure that we knew who would have appointments, how many appointments, and when those could be. So that needed to take priority over planning longer into the future. But also it gave them an opportunity to review what the expectations are and make sure that what we had been planning for the priority populations didn't need to change. We don't want to release information to the public that we then will have to change going into the future. So we just wanted that extra time to review the new situation and make sure that our plans were still consistent with what the new information brought us.
Okay, thank you. So what is the expected timeline to release that vaccination schedule? Can Manitobans expect to see that list before Pfizer deliveries get back up to speed?
We plan to release our priority population list on Wednesday. The dates that will be attached to that list will have to remain quite fluid because we still don't know exactly when to expect the Pfizer numbers to change, but we will come up with at least the sequence for Manitobans, and we'll be announcing that on Wednesday.
Great, thank you. And can you provide an update on the proportion of eligible healthcare workers who have accepted the vaccine? Are we tracking that?
Yeah, I don't have the exact numbers in front of me, but in my discussions with the team who does the booking, they're telling me we're fairly consistently seeing about 70 to 80% uptake in our eligible healthcare workers.
Thank you. Moving to global now, and Joe.
Hi there, Dr. Reimer. I guess I'll just follow up on those last questions. On Wednesday, when we get the eligibility list, are we getting everything from seniors to the general population, or just maybe seniors not in personal care homes?
So we'll be releasing a list of all of the populations that we intend to prioritize, over the entirety of our vaccine rollout. There may still be some unknowns in that, but we'll make clear where those are. But the plan is to release the sequencing of every population that we've decided upon for the extent of our rollout.
And so after this week, when all care homes are taken care of, can they breathe a sigh of relief and maybe burn it down a notch when it comes to strict protocols in the homes? I mean, not just throw up their hands and forget about everything they're doing, but I'm guessing there's a little bit of relief there, and they can maybe relax somewhat. Is that accurate?
I think I'll let Dr. Roussin answer about the plans for care homes after immunization is complete.
Yeah, and so, I mean, certainly not after this week, because we will need 2-dose series for those high-risk Manitobans. So we're still going to be planning the public health measures that are in place after 2 doses are in place, and we have good coverage in the workers and clients. Then certainly we'll revisit how we approach things like outbreaks, how we approach things like client transfers from hospital to these PCHs. But as of right now, a single dose in the highest risk Manitobans isn't going to change how we approach our public health measures.
Gotcha. And do we know, so after all consenting seniors in personal care homes are offered one, do we know how many so far are getting the vaccine?
Again, I don't have the exact numbers in front of me, but what I've been hearing consistently when speaking to the team is that in every personal care home, they're seeing uptakes above 90%.
From the Brandon Sun, Michelle.
Good afternoon. As usual, I have some readers' questions. The first one is, why are frontline workers, like Brandon City police officers, not being immunized when they are in direct contact with proven COVID-positive people each day? They have received no answers as to why they are not on the list, nor are they informed of people who are COVID positive. What are their exposure rates versus that of the emergency department?
So we were very careful when we came up with the priority list for who would get access in the very first groups when we're talking about such a small proportion of the total population. We looked at a number of different factors. We looked at, as you're mentioning, likelihood of being exposed to the virus. But we also looked at things like, the critical nature of that service for our healthcare system. So that's where you see things like the critical care units getting first priority, because not only are they potentially exposed to the virus when caring for patients, but they also are an essential part of the most difficult work in the healthcare system, where Manitobans need to be able to rely on that service being available. So there's a lot of different factors that we have to consider concurrently. It's not just a matter of whether or not people were exposed. We're also looking to see, how many of the individuals in each population group have been shown to be infected. So, are there mechanisms that we can protect people, and how effective are they apart from vaccination? So we know that we're seeing more cases amongst folks who work in acute care, those who work in personal care homes, and those who work in group homes. Those appear to be the areas of where frontline workers have been experiencing more infections than groups like police officers, for example. So all of these factors came into our decision making and will continue to inform as we move through further priority groups. There are so many essential workers in healthcare and outside of healthcare who take care of Manitobans every day, and if I could give them all a dose, I would do that today. But we just have such a limited supply that we had to have these really difficult discussions around, where are we going to get the most critical workers protected for the reasons that I just mentioned. And at some point, we had to draw lines because we just simply have such a small amount of vaccine available.
Okay, thank you. Over the past week, we've heard that mental health is important. What is being done to recognize the sacrifices of kids and rewarding them for their hard work during this time? With the emergence of the Let Kids Play petition, for example, this past weekend, and overwhelming support from the public, will the province reconsider organized youth sports prior to the next set of restriction reviews?
Well, we never really take anything off the table. We're continually looking at those orders, and I can speak even from personal experience. Both of my children are heavily involved in sports, and you really miss seeing them out there. So this affects all sorts of Manitobans. What we do know is that this is what we had in the fall, and we saw transmission occur in these events, and we just can't open everything up. There's a lot of important things out there. A lot of impact on many different people, mental health, economic impacts, but we just can't be back to where we were in November. And so these are the tough choices that we make, but we have to do things in a cautious way. And there's no reason to think that if we open things up again to where we were in October, that we would get a different result this time. We know at that level of opening, we're on a trajectory to overrun our healthcare system, to cause a lot of hospitalizations, a lot of deaths to Manitobans, and so we need to be very cautious moving forward.
Right, thank you. And previously, Dr. Roussin, you've hosted a telephone town hall so that Manitobans could see clarification directly. Will you be hosting another town hall within the next week or two prior to the next restriction review?
Yeah, it's a good question. I'm not sure. I think it would be something we consider. We had real good feedback. I quite enjoyed speaking to Manitobans on those sessions. So I think it'll be something that we'll certainly look at.
From CJOB, Will.
Hi, good afternoon, everybody. Dr. Reimer, I'm wondering, can you tell us a little bit more about the enhanced consent process you announced earlier? For somebody who's in one of those groups, what might they be asked or what might they be told?
Sure. So we have put up on the website some guidance for healthcare providers that will assist them to work through the enhanced consent with their patients. So, for example, for individuals who have an autoimmune condition, of which there is a long list, the enhanced consent goes through what is known and what is not known about the COVID-19 vaccine and how it may or may not have special impact for people with autoimmune conditions compared to the general population. So what we're asking is that for those individuals who have one of the conditions listed, that they talk with their healthcare provider ahead of time, go through the guidance document that we've created, and then we created an additional consent form that just basically indicates that, yes, the conversation has happened where the risks and the benefits and the unknowns have been discussed. And then they can move on to the regular consent that everybody does around the risks and benefits and unknowns about the vaccine more generally. For those people who want, we can also have this enhanced consent occur at the vaccination clinic. And knowing that sometimes these complex discussions would be better to happen ahead of time with their healthcare provider when their conditions are particularly complicated. If it's more simple and they want to proceed with an appointment, we can have those longer discussions at the clinic as well.
Awesome. Okay, thanks for that. Also wondering about that situation you discussed earlier, potentially needing to decide between the two groups who gets the second dose of the vaccine. What could maybe be the results of not getting your second dose immediately, and how long would that other group need to wait potentially?
So on the impact of delaying the second dose, I mean, the short answer is we don't really know, because the studies that the companies didn't delay the second dose. But the longer answer is that, when we've looked at other vaccines, when you push back by a week or two the second dose, typically you don't see any negative impact on long-term immunity. So we're anticipating, based on the science around vaccines in general, that if people have to wait an additional week or 2 weeks after the original date for their second dose, that their long-term immunity likely won't be any different than had they gotten that at the 21 or 28-day mark. We also know that for people who are elderly, they tend to have a lower immune response compared to younger populations. That's why we're making sure that we prioritize the second dose on time for the personal care home residents, because in the case that they had a lower immune response to that first dose, we want to get the second dose in as close to on time as possible, just to give them that extra boost and increase the likelihood that they would be able to fight off that infection if they were faced with the virus after immunization. So broadly speaking, the main risk with delaying the second dose is whether or not there's decreased immunity in those few weeks while you're waiting for that second dose. None of the studies really looked at, how well people's immune response stayed if they didn't get the second dose, or if that second dose was delayed. So those few weeks in that time period is a bit of an unknown. So far, fairly encouraging that most people will have a decent amount of immunity despite the delay of 2 weeks, except potentially in our elderly, which, as I said, is why we're trying very hard to prioritize that population.
Okay, thank you very much. And final question will be for Dr. Roussin. Dr. Roussin, does the 250-person capacity limit apply to places like Polo Park, or for outlet malls in general? Does the order defer to the 25% capacity limit for each individual store?
That's right. Yeah. For each a unique store, it has a 25% capacity, and if the store is very large, where that 25% capacity would be very high, then that's capped at 250. So it's whatever is lower. For the malls themselves, the capacity is 25%.
From the Winnipeg Sun, Scott.
Hi, good afternoon to both of you, Scott Bill and Big Sun. Dr. Reimer, I just want to go back. I believe in your preamble you said there is, a decision upcoming, depending on what happens on February 8th, whether or not to give second doses to the PCH population, or to do second doses elsewhere. Given what you just said there about the older population, it being more important to have that second dose just because of their immune response, would that be the way that you guys are leaning to ensure that the PCH population then does get that second dose?
Yeah, thank you for that question. I'd like to clarify. So the decision is not which population we're going to prioritize. The decision is whether or not we're going to have to postpone the second dose appointments at the super sites. So we are looking at our numbers, and we're going to ensure that if we're not receiving that shipment on February the 8th, that we reserve enough doses to be able to provide the second dose to all personal care home residents. So we are prioritizing our personal care home residents to get the second dose on time. What we're waiting for, and plan to tell Manitobans on Friday, based on what the federal government is telling us is the timeline, is to determine whether or not we'll have enough supply that we can continue starting February 1st with those second dose appointments at the super sites on the dates that they're already booked, or if we'll need to postpone them by a week or two.
Okay, thank you for that clarification. Dr. Roussin, there's been a lot of talk over the weekend, about the new opening, allowed openings and that sort of thing. People seem to get caught up on the fact that you're allowing children to be in school for up to 8 hours a day, staff included, in small confined spaces. You say that that's where the virus transmits, in closed spaces for long periods of time. But gyms aren't allowed to open, restaurants are not allowed to open. People don't typically spend as much time at those venues. I guess people are wondering, why is there this? What would seem, a discrepancy between one ability to have, a school open and not to have a place that would have less people based on capacity limits. In pretty much essentially the same sort of setting, indoor, enclosed, that sort of thing.
Yeah, so there's a couple of things with that. One is that we just haven't seen a lot of transmission in schools. So there's a lot of safeguards in place. And, in addition to that, that should be a priority for Manitobans to be able to have the kids back in school. So there's a lot of safeguards in place, and despite seeing cases, of course, when we had high community transmission, we're going to see cases in school. We just haven't seen a lot of transmission in schools. We have seen transmission in those other settings, and again, we've been through this, right? We had these things open in October and November, and we were on a trajectory to overrun our healthcare system. We kept schools open, but closed other things, and you can see what happened to our numbers, where we are now. Now our healthcare system's just starting to get back into electives. If we go back to the openings we had in October, November, we will immediately start right back onto that trajectory. It's not reflective of the hard work of Manitobans. It's reflective of the nature of this virus. And so you can look in jurisdictions around us, the restrictions that they're requiring to put in, and it's just the nature of this virus. So I think it's very, easy for people to understand. A person whose business has been shut down, or who's lost their job. It's very easy to understand why it's very important for them to get back. It doesn't change the nature of this virus. We were on a trajectory that we couldn't sustain, so we had to make these changes, and we're going to have to be very cautious moving forward because we don't want to find ourselves back in that spot again.
All right, thanks for that. And just a last one, more along a similar vein. 28 of today's 113 cases came in that kind of school age group from 0 to 19. Can you explain where those cases are coming from then? Are you seeing them in schools? I don't believe we're getting a lot of those school updates in terms of cases anymore. So I guess I'm trying to wonder where, approximately, 30% of our new cases today are coming in that age group.
And so for the most part, when we had the very high community-based transmission, those age groups were making up a proportionately much smaller amount of our cases. And so we'll see some fluctuation with that. But in cases in schools, we do very thorough contact investigations, find those cohorts, and so we just haven't seen transmission happen within school. So the majority of those cases, there certainly is some transmission that occurs, in school, but the majority of the cases are acquiring it in places outside of schools.
From CBC Radio Canada, Gavin.
Hi, Dr. Roussin. A question for you. On yesterday's numbers, our daily case counts were up, our test positivity rates were up, ICU numbers are up. That's sort of continuing today, although the numbers are from a Sunday, so the case counts are kind of down. Was it the right call to start opening up now, even though all those indicators are on the rise?
Well, it's a challenge. We're going to see some fluctuation. We certainly saw our numbers improve dramatically from where we were in November and December. And then we didn't see a large spike after the holiday gathering, certainly not in all of Manitoba. We know now that there's a lot of activity in the northern region. And but we've been in very restricted territory for many, many weeks. And so we thought with the trajectory we saw, we could do a very cautious reopening And we think that's what was provided. And then you'll see, again, questions just minutes ago about why we didn't open more. And we'll also get questions on why we opened at all. And so I think it's just the nature of the time we're in. It's a very challenging time, but I think we have to make decisions and be very cautious, knowing that it's the numbers that are going to guide our actions moving forward.
On those infections in the north, do you have any idea on the origin of the outbreaks at this point? We're seeing multiple relatively isolated communities with outbreaks. Are there any sort of patterns on how the virus is getting into these communities? Is it, say, medical travel to Winnipeg, travel for supplies to somewhere like Thompson? Any patterns there?
Well, there's a number of communities that are experiencing cases at different levels and at different stages of their outbreak. So, I'm not aware of any one common theme. It will certainly be from some sort of travel and back into community, and then just like anywhere else, when we see outbreaks, it's caused by gatherings. So larger gatherings, and then we see a large amount of contacts, and then a certain amount of those contacts will become cases. So it's it's the nature of this virus. The more we gather, the more spread we're going to have.
And finally, a question for Dr. Reimer. You sort of asked this before, but I'd like to ask it a bit more precisely. Do you expect that some of the postponed appointments, if they do have to be postponed, will be postponed longer than the 42-day period recommended by the National Advisory Committee on Immunization?
So at this point, we are completely dependent on the supply of doses that comes from Pfizer through the federal government. We will provide those doses as soon as possible for people who are awaiting them, as soon as we have them. Based on the numbers that we're hearing so far, we should be able to provide them on time, or at least within the acceptable range. But that, as I said, we thought we had estimates for how many doses we'd be getting this week, and now we're receiving no shipment this week. So we will be working our absolute hardest to get the vaccines to people as soon as we have them. And we will be updating Manitobans as soon as we know about our future shipments, which what we're being told right now from the federal government is that we'll be getting that update at the end of this week.
From CBC Manitoba, Bart.
Hi, Dr. Reimer. On Wednesday, when you come out with that list, will people aged 80 and over remain the next priority group at the top of that list? And if not, why not?
Well, I think we've been clear throughout that elderly Manitobans are a priority group for us going forward. And so we'll have more details about exactly which groups will be occurring in what order on Wednesday.
Oh, yeah, I was hoping for a yes or no. Dr. Roussin, the largest or the highest number of active cases right now is listed in Island Lake, but we know that there's active case numbers, there's a bit of a data lag. What's the proxy number of active cases in that Island Lake Health District that's actually active?
Yeah, so I don't have the that number. For a First Nation, we'd ask for specific questions like that can be directed to FNIB. But you're right, that is an area where we're seeing a lot of transmission. There's a lot of work from all levels to address that. Through the public health approach, and so we're really concerned with the level of transmission that's happening right now.
What, to your knowledge, is the total number of people in ICU with all medical issues this morning? Total number, not just COVID.
Yeah, I don't think I've been provided that number. I'll give you the COVID the patients if you can accept that for now. So they have total ICU COVID is 36, with 23 being active.
From Canadian Press, Steve.
Oh, hi, Dr. Roussin. As we're coming out of the severest restriction period, I'm wondering if you could comment on where we saw transmission occur when most businesses were shut down or very limited in capacity, that sort of thing. Looking at the weekly reports, it says household contacts, but obviously somebody in that household has to bring it in. So can you comment generally on where this transmission was occurring?
Yeah, and so so part of it is that we had a very high community-based transmission, and so by definition, we don't know where those individuals had acquired it. The other thing is that a lot of the numbers will be skewed because, like you said, so many things were closed at the time. So the big places were workplaces that are listed, and household, and that's mostly because there wasn't many other places open at the time. So it's a bit of a challenge when we're looking at acquisition contact tracing, because we'll see people who, obviously became a case. If we can't link them to another known case, then we sort of just look back in that 2-week period on where likely they have acquired it. So many of our numbers are not mutually exclusive for that. If somebody was at work and then was at a retail setting and was at another location, all those locations would be listed as potential acquisition sites. So when you have a high rate of a community-based transmission, it's really difficult to pinpoint.
And given that percentage of cases that were traceable, did that tell you anything about whether people were following the rules, or were you seeing a lot of cases that were transmitted in, say, close indoor gatherings, social visits, that sort of thing that weren't supposed to occur?
Yes, we do. We do see that. We've seen that all along, where like I mentioned, where there were gatherings that weren't supposed to occur through multiple households. We've seen transmission where people have gone to work or other locations while symptomatic. We've had contacts, people who should have been self-isolating. We have people who, either related to travel or being named as a contact, were to be self-isolating. But then members of that household also became cases, which meant it was a substandard isolation. Of course, there's many situations where it's, it might be very difficult for certain populations to be able to effectively self-isolate within their house, but, many of us are able to do that. And we also have alternate isolation accommodations there. So, it's like we said many times here, is that there's nothing about this virus that really surprises us anymore. We know exactly how it's transmitted, and when we see outbreaks, it never surprises us how they were started. They're always from gathering, they're always from somebody not effectively self-isolating, not staying home when they're ill. And so it's, so it is challenging, especially when we're in this now for, over a year, that we try to really stick to those fundamentals, because we see in many outbreak situations, it's exactly that. It's a breach of the fundamentals that have that started these outbreaks.
And my final question is for Dr. Reimer. I might have misunderstood your comments near the beginning of this afternoon's proceedings, but I think you said roughly around 80% of healthcare workers, there was an uptake there on the vaccine. The remaining 20%, I don't want to jump to the conclusion that there was some reluctance. So was it reluctance, or was it a scheduling issue? Was it a, I'll do it later kind of thing? What was the reason for not 100%?
We're actually really happy with the 70 to 80% uptake. That's a very high uptake rate for an immunization campaign. And there's a variety of reasons why individuals may not have decided to go for their vaccine initially. Some of them had the health conditions that I was mentioning earlier, which meant that they weren't eligible when we initially rolled out the vaccine clinics. So if they had autoimmune conditions, if they had immune compromising conditions, if they were pregnant or breastfeeding, all of those folks were eliminated from eligibility at first. And as I mentioned last week, we created a new enhanced process that would allow them to be enrolled in future clinics as they open up. Some people may have other health conditions or allergies that made them concerned and want to seek some opinion from their healthcare provider before booking an appointment. So those folks may be in the process right now of discussing with their healthcare provider whether or not a vaccine is a right decision for them. And then we've also heard of healthcare providers who wanted to let other people go first. They felt that their exposure or their own health status was such that they didn't want to take up an appointment when there's other people who might be at higher risk because of their own health, their age. And so, we've certainly heard of people who are choosing to wait until we have more supply available rather than taking up one of the early slots. So I think there's a variety of reasons, but overall, it's really a good news story for us that we've had such high uptake in our eligible healthcare workers. So I just want to thank everybody who has appropriately booked those appointments and come in to get their immunization done.
From CTV, Michelle.
Hi, my first question is for Dr. Roussin. When retailers opened at 25% capacity this weekend, we saw a lot of lineups outside stores. Did that concern you? And do you feel that closing everything down for so long created this pent-up demand to shop?
Well, I think it is concerning if we see crowding. The capacity limits are there, and they can be enforced outside if there's spacing and lineups, then it's less concerning. I think that closing things down has an effect, and there probably is that increased demand, but we didn't really have an alternative. Our healthcare system was on the verge of being overwhelmed, so we needed to act, and that action has now brought our numbers significantly down and has allowed the healthcare system to get back to some of its elective procedures. So I think there's always some unintended consequences when you do these things, but looking back, we didn't have much alternatives.
Okay. The next one for Dr. Reimer. You said right now we rely fully on the federal government for vaccine supply. Is there any way that we can't be fully relying on the federal government for vaccine supply?
Our vaccine supply is exclusively obtained through the federal government. They have been working with the manufacturers and developing contracts and agreements with the manufacturers. So Manitoba is working like every other province and territory in Canada through that same mechanism to ensure that all of Canada has equitable access to vaccines through a centralized process.
I also wanted to follow up about the Moderna shipments. When is our next one expected, and are you expecting the same amount? And would you consider if we had the supply to use those in the Winnipeg and Brandon super sites?
So our Moderna shipments have so far been arriving on time. We receive approximately 7,300 doses every 3 weeks. It's not the same every shipment, but that is the typical amount so far. We are expecting that to go up in March, according to what the manufacturers and what the federal government has told us. But for now, the numbers that we're getting are generally around 7,300 every 3 weeks. We would absolutely expand the use of Moderna if we had more Moderna available. While the supplies have not been disrupted, the total number of Moderna doses is still lower than what we had been receiving from Pfizer. So it does limit how the Moderna can be used when we receive lower numbers. But going forward, if Moderna becomes more available, if those numbers go up, we will absolutely be looking at that and considering how we can most effectively make use of all products that are available to us.
From City TV, Jonas.
Good afternoon, folks. Dr. Roussin, it was a big weekend for Manitobans. They were back out and about.
Your thoughts on what you're hearing anecdotally about actions and the way folks responded this weekend to their first freedoms in a while.
Yeah, I don't have a lot of detail on that. I think that it's just important to know that this virus is still with us. The restrictions, the messaging on the fundamentals is what's going to keep our numbers down, to ensure our healthcare system can continue to function by increasing our contacts. We'll get those. So we always have to be on guard for this. So I think it was Manitobans worked hard to get our numbers down. I think it was appropriate to have this very cautious lifting, but we can't forget what got us into that bad spot in the first place, and that's increasing our contacts and putting us all all at risk, putting our healthcare system at risk. So we just encourage the people to ensure that we're still sticking to the fundamentals. To try to always practice those fundamentals, and hopefully we can continue this progress over time.
If folks are out and about, Dr. Roussin, and they want to get out, and maybe just a message about taking your own kind of safety into your own hands. If something feels wrong, I suppose maybe that's your best kind of indicator.
Yeah, I think getting out and about, I don't think this weekend was really the weekend that allowed that. Our restrictions always allowed Manitobans to be out and enjoying the outdoors and being active. So this has just removed the essential items list from retail, again, with a lot of capacity. And so, yeah, I think that it's incumbent upon all of us to ensure we keep these numbers down. If we're into crowded places, if we're going out when we're ill, if other people are going out when they're ill, if we're having large gatherings within homes, we're just going to simply see those numbers come up again. And then we'll be in a position now where we can't continue to open things. So, this virus is with us, and this virus is going to be with us for still many, many months. And so we just can't lose sight of that.
Just a thought, sir, as well on the trends in Winnipeg. 33 total new cases reported here today, our lowest since mid-October. And I imagine as we break down these numbers, there's probably more of these cases are from maybe more vulnerable populations. Just a thought on what is happening in the capital right now.
Yes, so we're certainly seeing a favorable trend in most areas in the province right now. I think that it's clear that the most hit area right now is the north and many areas in the north. So, I think that, again, it's been that hard work of Manitobans that to bring down these numbers, to allow us to, a very cautious reopening. But more importantly, it's what's allowed our hospitals to get back to providing care to all Manitobans. And so I think we can't lose focus on the fact that we were here before. In Winnipeg, we were at these numbers in October. But we had too many contacts after that. We had too many things that were open. And then we started on a trajectory that required us to get into these restrictions. So we can't lose sight of that.
From CHVN, Taylor.
Hi, good afternoon. I think all three of my questions are for you, Dr. Roussin. What should parents do when they need to take their kids out to a store or run errands?
Yeah, I think that, we've always said go out if you're doing shopping for essential things, have the least amount of people go from your household. Certainly for me, that's a very easy thing to do. For others, it's not. And so taking the least amount of people from your family out, ensuring everyone is not having symptoms, wearing a mask, washing hands, and trying to physically distance from others. So there are ways to get out. Certainly getting out and enjoying the outdoors, staying active is very important. If you have to go shopping and you require to bring some members of your family, then it should be the least amount that you require, and everyone should be masked up, washing hands, and practicing physical distancing at all times.
And we all get colds, have allergies, people have asthma. How do people who typically experience these kinds of separate, regular symptoms separate them from potentially having mild COVID symptoms?
We knew that was going to be a challenge. We knew that was going to be a challenge in the summer when we started advising all Manitobans to prepare for degrees of absenteeism that we've never experienced before, because we know there's going to be mild symptoms. We actually thought there would probably be a lot more respiratory viruses other than COVID circulating, which would compound things even more, but we just didn't see that. The messaging right now is we're at a point where we want to start reopening things. And so we have to be able to do so without widespread transmission of COVID. So if you have symptoms, even mild ones, even if you're not sure, I suggest getting tested and self-isolating pending results. It's the best way that we can protect ourselves, the people around us, and it's the best way for us to start getting things moving here with our reopening plans.
Thank you. And we've heard from community leaders from different northern communities who are anticipating, hoping for more of that community-based move when it comes to easing restrictions. Since early last week, has there been any more discussions about potentially doing community-based versus region reopening, especially since a lot of people from the north are very used to traveling to Winnipeg to run errands?
Yeah, so we always discuss what the orders are in place and what could occur with the next time or the interim. So we're always discussing this, and I think it goes back to the challenge that we've mentioned with with sectors that aren't able to open, now a region not able to open, and I think anyone can understand their concerns and understand how frustrating it might be. But again, we're here trying to reduce the impact of this virus on our entire population. And so right now the test positivity rate is quite high in the north. We see outbreaks in many areas throughout the north. It's not just in certain places. And so we wanted to be able to get back to the targeted approach. We heard from Manitobans in the EngageMB.ca survey that they wanted us to get back to the targeted approach. And with that targeted approach, it's, we had the option of leaving the entire province at the previous restrictions because our numbers are just enough now to get things back, or do we leave the restrictions on the region with the highest test positivity and active cases? And so the decision was to do that, to loosen in the areas where we could and keep it restricted in the most hard hit region right now. And we'll continue to review that. Of course, there's mobility, and if the mobility is there, then that compromises our targeted approach. And so when that targeted approach is compromised, it doesn't mean we loosen up the heavily restricted areas. It means we have to tighten up everywhere. And so we really hope we can rely on this targeted approach so that we can still have some regions with gradual lifting. But we'll have to keep reviewing things.
And speaking of the north, we head north now to Ralph from the Opaskwayak Times.
Hi. We're getting conflicting numbers reported in the Opaskwayak Cree Nation arm of Kelsey Health District in the Northern Health Region by a local municipal official that reflect a difference of active cases. He announced 2 active cases versus the 68 on the COVID dashboard. What is the correlation of lag time reporting in regards to the COVID dashboard, and how the contact tracing lag time reporting may be affecting the actual true numbers? Is it days or weeks?
Well, it depends. So the active case count again is is a surveillance tool, right? It's not related to our public health measures. So people who are infectious are required to self-isolate. When they're done the infectious period, they're not going to be self-isolating, although there's sometimes a delay in reporting that. And so again, I don't have the exact numbers on that right now. There can be a discrepancy between the actual active cases and the reported ones. For that reason is that most people are focused right now on contact tracing and finding cases rather than removing people off of our surveillance list. But again, there's the test positivity is quite high in the north, and we know there's a lot of mobility. So every order that we've put in, when we've closed restaurants, we know that they're a high risk setting. I'm sure there's a lot of restaurants that went above and beyond to try to prevent the transmission of this virus, but we can't write orders that way. We're writing orders for an entire province, and it's the same thing here. We have a targeted approach. It's the most targeted approach we've had since way back in October. We've been able to loosen some of the restrictions cautiously in almost every region. But in the region in the north where we see the most test positivity, we have to keep those restrictions in place. And then, of course, there's going to be sectors, there's going to be individuals, there's going to be communities within there that feel that they could open. But it's very challenging to write these orders at a much more targeted approach than at the regional level. So we'll continue to review it, and we'll continue our public health approach to try to bring down those numbers in the northern region so that we can all loosen some of these restrictions.
No follow-up. Thank you very much.
Thank you. From the Thompson Citizen, Ian.
Dr. Reimer, last week when it was still going to be the Pfizer vaccine, there was going to be 1,100 doses sent up to the Thompson vaccination site. How many doses are going to be sent up now? Is it the same or is it a different number?
The number, now that we've moved to Moderna, we have a bit more flexibility in the number that we can send. Pfizer comes in trays of about 1,100 doses, so it makes it a lot less flexible deciding how many doses we can be moving to different locations. I don't have the exact numbers in front of me, but we will be sending at least 500 initial doses to the north, and those will be provided both in Thompson as well as the PA and I forget the third. Sorry, I'll just take a look. And Flin Flon. So the doses, that was after discussions with the Northern Regional Health Authority, that because we're using Moderna and have a little bit more flexibility, that it would be more beneficial to split up the location of the doses rather than have them all in Thompson.
Okay, thank you. And what's like the maximum number of people who could receive a vaccination a day at the Thompson site?
I don't have the total number in front of me of the staff that will be in Thompson, but we can get that for you. But what I would say in the short term is we will have whatever staff is required to provide the doses to anyone who is booked and is eligible based on the supply that we have. So the staff at the clinic will not be a limitation to providing those doses. We will ensure that the clinic uses up every single dose available when they have them.
Okay, and so is there like staff that have actually been hired for it now, or are they or have they just been brought over from somewhere else? Since it's sort of opening kind of temporarily at first.
So our human resource team has been working with Thompson, with the PA, with Flin Flon to ensure that staff are fully trained like they are at our super sites. So they are actively working right now on making sure that whoever is providing the vaccines in those locations has gone through all of the relevant training to be able to do that both for this clinic and then ongoing as supplies increase.
And closing things out today, Josh from the Steinbach Carillon.
Hi there. From what I understand, there are patients who aren't vaccinated in hospitals waiting for placement into personal care homes. Will PCHs take these people who aren't vaccinated?
Yeah, so our plan right now was to prioritize the personal care homes and as quickly and efficiently as possible to get everyone who's currently in a personal care home vaccinated first. But the FIT teams or the focused immunization teams will be doing ongoing sweeps coming back to personal care homes. So for example, if somebody has been admitted to a personal care home after dose 1, they could get their first dose when the team comes back for dose 2 for the rest of the facility. And then the teams will continue to come back periodically to ensure that any new admissions also have the opportunity to get immunized. Additionally, as we have more availability of those teams and obviously more doses available, our FIT teams will be going and doing visits to other places where people may be waiting for admission to personal care homes, such as hospitals or transitional beds, for example. So both of those things will be occurring at the same time, such that anybody who is eligible to be admitted to a personal care home would be able to still be admitted there even if they're not immunized, but that our teams would be coming back to provide that immunization if they didn't get it before they were admitted to the PCH.
Okay. Could you tell me, can patients even like be admitted into care homes under Code Red, and that's continuing?
Yep. It's so the if a facility is under an outbreak, then the typically admissions are declined. If we're in the restricted level, but a facility is not under an outbreak, then typically transfers could occur.
Okay. Would you also happen to know if the wait lists have sort of become longer in order to get into PCHs then? Like, would they be backed up?
You know, I don't have specific details, but certainly the where we were with a number of facilities and outbreak, then yes, there's been some delay in transfer because of that very reason.
And that concludes today's media briefing. Thank you.